Hi everyone, Rob from injuryfitpro.com. If you've seen my video on the 5 things you should know about before receiving facet joint injections, in this video I'm going to give you 5 more things that you should know about before receiving those injections. Will an epidural injection be performed as well as a facet joint injection? So a great thing that I see all the time, quite often, is a patient goes in for a facet joint, maybe a couple of facet joint injections, they end up having an epidural as well. Okay, probably really good for pain relief in terms of, they've covered all their bases there, they've covered the epidural in case it's kind of coming from the epidural space, or if there's some discogenic pain, or it's the posterior longitudinal ligament that's inflamed, and they've done the facet joint injections. But really, has it told them anything? Has it educated the clinician? Has it educated the patient as to where their pain is coming from? Not really. Has it given them an extra dose of steroid? Yes, it has. Because an epidural injection is going to be probably, 10 times more steroid than you would be using with a single isolated facet joint. And as I said, the other thing is you're not then really knowing for the future where you should be going if you need to repeat that injection again. Is the relief permanent? No, it's not. A facet joint injection is a short-term relief. With that said, I have seen plenty of examples where a patient's been in chronic pain, they're having to get out of their pain, they've had a facet joint injection, and actually has ended up giving them quite significant pain relief for a long period of time. Yes, once that steroid has worn off, maybe after 3 months, their pain may well come back to a degree, but quite often doesn't come back as much, because what's happened is you've given them a pain-free window, they've been able to maybe lose some weight, do some exercises, rehabilitate themselves a bit better because they've had that pain-free window. So in that context, yes, it can produce long-term pain relief. However, I don't like, and certainly the guidelines in the UK now coming out from the National Institute of Clinical Excellence would indicate that multiple facet joint injections repeated over and over and over again are not really a long-term solution for patients. And as I certainly would agree with that. So again, that brings me on to this point here. How often is that injection proposed to be performed by that doctor? So again, that's a question I would be asking. If they're then trying to get you back in again, a few months later and a few months again, and they're using that as a form of pain relief, that's not really best practice. Best practice is to really, yes, perhaps have a facet joint injection, but then use that pain-free window to then have some more manual therapy, do some better exercise, use that opportunity to give you a better long-term outcome, no matter manage your symptoms in a better way. Do you know for sure that you have facet joint pain? Well, usually the best chance that injections will work for you will come when you have a combination of clinical signs of facet joint pain, so things like pain that is worse when you're standing, pain that's worse when you're walking because that rubs and approximates the joints together, and pain that is relieved when you're sitting. Correlating that with perhaps clinical findings such as MRI scans or X-rays or CT scans to show that there is inflammation or there's wear and tear around a particular facet joint. In that situation, then that's the best chance, I would say, that the injections are more likely to work. However, I'd be quite careful of going for injection too early and certainly multiple injections too soon. Yes, there are situations where the clinician, the doctor, will have to do some diagnostic injections. They're not quite sure where the pain is coming from. They might want to inject 1 or 2 facet joints to see if that gives some pain relief, and if it does, then fair enough. Now that's where the pain source was. But I've seen situations where, in my opinion, people have rushed into facet joint injections too early. They've had some pain, they've had some therapy, it hasn't quite worked. They've gone to the doctor, gone to the pain doctor or the surgeon, and so they've put them forward for injections, and it's still not worked. And really, what maybe they should have done then was perhaps seen a different physical therapist, maybe try some different manual therapy techniques, especially if their MRI findings weren't actually showing that they had any wear and tear in their facet joints or any inflammation around that. Try some different options, maybe try some shockwave therapy, maybe try some prolotherapy injections instead of the steroid injections, or other options. Never be afraid to get more than one opinion, certainly in terms of physical therapy, before you end up going down the injections and certainly down the surgery route. That's one of my top tips. Okay, I hope that was useful, hope it was informative. In summary, I'd say, check to see if you have MRI findings or X-ray findings that correlate with clinical signs of pain coming from a particular facet joint. Be wary of multiple or repeated facet joint injections, and think about the alternatives that there may be open to you, such as manual therapy, such as dry needling, manipulation, deep massage, improving your posture, improving your core muscle tone. If you want to find out about all these sort of things and more, they're all covered in my book, Back Pain Decoded, available on Amazon and also from my website, injuryfitpro.com. Please do subscribe to my channel, click on the subscription button below. In the meantime, if you have any comments or anything you'd like me to try and answer, leave those in the comments section and I'll do my best to answer those. Thanks.